For my supplemental intervention, I chose Alcoholics Anonymous, a brief history of AA. The history of Alcoholics Anonymous started in 1934. It was founded by Bill Wilson, a chronic alcoholic who was destroying his life. In 1935, Wilson met Dr. Bob Smith, an Akron surgeon also struggling with addiction. Before meeting, Wilson and Dr. Bob had contacted the Oxford Group. The Oxford Group was a non-alcoholic fellowship emphasizing universal spiritual values in daily life. Alcoholics Anonymous is a guide to recovery through a 12-step program that is spiritually based, practiced, and worked with a mentor or sponsor. It shares personal stories of addiction and offers hope to those seeking sobriety through local meetings that they attend by the individual. The description of the intervention. It has been found that an overlap across an individual's sense of spirituality and an individual's recovery process. The implementation of a 12-step recovery support meeting in treatment centers and recommendations following a client's treatment stay have been found to increase an individual's efforts to remain sober when participating in a spiritual component, as well as develops a subculture that the individual can feel a part of, as well as increased overall fulfillment, replacing the use of substances with a positive peer group and spiritual practices. Effectiveness of the intervention, Study 1. In an article published by the Department of Psychiatrics of Massachusetts General Hospital Recovery and Research Institute, it had been noted that Alcoholics Anonymous has often been dismissed due to lacking evidence and effectiveness for the individual seeking to recover from alcoholism. Although there is no one-size-fits-all when seeking recovery from substance use disorder, it has been shown that Alcoholics Anonymous is no more or less effective than other clinical-based approaches such as CBT. Alcoholics Anonymous also relieves the economic burden associated with continuation of care as it pertains to those who display problematic drinking who may not be able to afford an alternative clinical-based approach for their alcoholism. The article argues that Alcoholics Anonymous showed considerably higher rates of abstinence versus other treatments such as CBT at a 12-month follow-up. When viewed, they looked at the continuous time of abstinence over a 12-month time. Those individuals in a 12-step support fellowship did as well, if not better, due to the concern of violating their achieved abstinence. It was concluded that although further research needs to be done and closely looked at in other countries, despite Alcoholics Anonymous being a global organization, but it has been proven and showed validity as a significant supplemental intervention to be used when working with individuals with alcoholism or substance abuse disorder. Effectiveness of intervention number 2. In an article published by the Journal of Alcohol and Drug Education, they discussed the overall effectiveness of Alcoholics Anonymous following a review, evidence of effectiveness in participation of Alcoholics Anonymous. Upon systemic reviews of these studies, it shows regarding causal evidence and effectiveness that Alcoholics Anonymous did meet 5 out of 6 needed criteria for effectiveness based on follow-up periods with individuals who attended Alcoholics Anonymous versus a clinical-based approach such as CBT. It was noted that it can be very difficult to prove effectiveness, as it stated AA has the potential to provide many benefits to its participants as it is cost-effective and widely accessible to many individuals and met evidence-based for criteria for effectiveness overall when viewing individuals who struggle with alcohol use disorder. Effectiveness of intervention number 3. In an article published by Stafford Medicine, they viewed 35 different studies and overall outcomes of 10,080 participants, determining that involvement of Alcoholics Anonymous was found to be nearly always more effective than other forms of psychotherapy in achieving long-term abstinence, as well as lowering healthcare costs. Noting AA success is contributed to the social interactions it creates between individuals who are working to achieve abstinence from alcohol use disorders. When studies measured abstinence achieved through Alcoholics Anonymous versus other interventions, the success rate was significantly better and reporting in some cases 60% more effective, and none of these studies found Alcoholics Anonymous to be less effective than any other form of psychotherapy. This study did exclude congruent fellowships such as Narcotics Anonymous. However, it was reported that this intervention could certainly be effective for individuals who use illicit substances such as cocaine and heroin as well. The study also noted the success rate in abstinence was not specific to any age, gender, or vocational differences. Recommendations for practice. Alcoholics Anonymous is a 12-step based approach that leans on behavioral, cognitive, and spiritual aspects and principles. This program emphasizes self-reflection, spiritual growth, and helping others. Some principles include accepting powerlessness over addiction, having faith in a higher power, and making amends for wrongdoings. Coping strategy. The program of Alcoholics Anonymous incorporates practices such as avoiding triggers, seeking support, practicing healthy distractions, managing stress, and making lifestyle changes. Spiritual growth. Alcoholics Anonymous provides a secular way for people of all religious beliefs to develop spirituality. Practice includes meditation, prayer, and involvement in local meetings. AA meetings can be open or closed and can include discussions, speakers, or group studies. Common meeting formats include AA preamble, a moment of silence for the Serenity Prayer, and reading from the Big Book. Each meeting is held in a common format, but every individual meeting may have some differences. Symbolism. The triangle displayed in Alcoholics Anonymous represents the program's three legacies of recovery, unity, and service, which are remedies for alcoholism's physical, mental, and spiritual aspects. The circle around the triangle represents AA. Conclusion. In conclusion, although there is no one-size-fits-all approach when dealing with individuals recovering from substance abuse disorder, it has been shown that a 12-step recovery support meeting yields significant results as it pertains to achieving long-term sobriety. This could be due to multiple reasons such as lower economic burden, accessibility, and willingness to explore spiritual practices. Regardless, Alcoholics Anonymous has shown validity as a supplemental intervention when working with individuals experiencing problematic behaviors as they pertain to drinking and achieving long-term sobriety.